don't know if anyone's come across the BATHE model for exploring empathy and increasing empathy. Empathy is quite a difficult thing to teach, but you'll find this in John Murtagh's tome, but BATHE stands for exploring the background of the patient. Tell me what's going on in your life. The affect, how is the person feeling, reflecting the patient's feelings, asking the patient what's troubling them most, T for trouble, how they're handling the problem, and doing it all with an empathetic attitude that must be difficult for you. So there are tools out there that you can help teach empathy. And then there are many, many other issues you could be commenting on in a consultation, such as time management, how registrars use the clinic resources. They're often more skilled at it than me, I find. When I say clinic resources, that includes the supervisor. I usually encourage registrars to call on their supervisor for help, as they normally would, so you can see what is actually going on for the registrar in the clinic. There may be issues with the locus of control, where the doctor is dominating the consultation, or maybe the patient's dominating the consultation. That becomes an area to explore. This is a common theme in ECT visits, how registrars manage the uncertainty of general practice. There may be issues with boundaries, doctor-patient boundaries, that the ECT visit becomes a good forum to discuss that if an issue comes up. Just to bring it all together, one model that's quite useful when you're observing consultations is to think about what the registrar has done that has made their consultation effective, made them effective in the consultation, and then what they could do more or less of to increase their effectiveness. And Chris mentioned this in the context of the RACGP feedback form. And I actually encourage registrars to think about that at the end of their consult, when they've written their notes, what did they do that made them effective and what might increase their effectiveness, and get them to give me feedback before I give them feedback.